Lactoferrin and its active metabolite lactoferricin are multifunctional proteins and are known to possess antibacterial, antifungal and antiviral activities, as well as immune regulatory and anti-inflammatory action. Lactoferrin is a component of whey protein, but it can also be found in high concentrations within the mucosal secretions, such as the airway mucus, the tears and the breast milk. Lactoferrin is produced and it's stored within the cells of the nasal mucosa, and it's presumed to be important as a first line of defense against invading pathogens. Research suggests that lactoferrin might be beneficial for alleviating the symptoms and the complications of the common cold for at least two reasons. First, it can kill bacteria through the binding of iron molecules that would otherwise be needed for essential bacterial functions. And secondly, the lactoferrin exerts an antioxidant effect by preventing the formation of free radicals, thus decreasing nasal tissue oxidative damage. Studies suggest that decreased levels of lactoferrin play a role in the development of chronic sinusitis, especially when nasal polyps, asthma and/or allergies are involved. Lactoferrin production is reduced in people with sinus conditions compared to healthy subjects, and moreover lactoferrin levels are particularly low in sinusitis patients with nasal polyps. The low level of the lactoferrin associated with sinusitis is due to both its decreased expression and its down-regulation, as well as its increased utilization to fight an infection. Since the human body can't synthesize vitamin C, it has to be acquired from the diet, and research shows a sufficient daily intake of ascorbic acid is required for the immune system to defend the body against infections, especially viral infections. Evidence suggests supplementation with 1,000 milligrams of vitamin C can decrease the risk of catching a cold. When given in high doses, greater than 200 milligrams per day, the vitamin C has been shown to reduce the duration of cold symptoms by 1 to 4 days. Vitamin C markedly improves immune function by enhancing natural killer cell activity, interferons, which are signaling proteins that boost immune response, macrophages, T lymphocyte production, and cell movement, and cell-mediated immunity. Individuals with sinusitis typically exhibit decreased serum levels of vitamin C. Topical vitamin C can be associated with enhanced mucociliary clearance of the paranasal sinus through the loosening of thick mucus secretions, an increase in ciliary beat frequency. Oral vitamin C supplementation also reliably decreases plasma levels of histamine, a known contributor to the inflammation and nasal congestion, especially among the people with allergy-induced sinusitis. Zinc is an essential trace element and is required for a variety of metabolic processes, including the maintenance of healthy immune function. Unfortunately, zinc deficiency is prevalent throughout developed Western countries. Zinc deficiency, which is common among the elderly and the young, is linked to the impairment of many components of the immune response, including the T and B lymphocyte function, the natural killer cell activity, macrophage phagocytosis, and antibody formation. As a result, a zinc deficiency is associated with an increased risk of infection. In one study, children with chronic rhinosinusitis exhibited lower levels of antioxidants, including zinc, than the healthy subjects. Correcting the zinc deficiency with supplementation is efficacious for a variety of viral infections. This might be partly attributable to zinc's positive effect on the expression of interleukin-2, as well as on the natural killer and cytotoxic T cells, which all help the immune system to kill viruses. Zinc supplementation has long been considered an effective therapy for reducing the duration of the common cold. A 2011 study concluded that zinc supplementation significantly reduced both the duration and the severity of the common cold when it was administered within 24 hours of the onset of symptoms. The study also revealed that zinc supplementation over 5 months was helpful for preventing infection by common cold viruses. Likewise, a clinical study involving zinc nasal gel, given within 1 to 2 days of an illness onset, found that zinc was able to reduce the severity and the duration of the common cold symptoms among the healthy adults. In a 2012 study, researchers found a combination of zinc and vitamin C was more efficacious than placebo at reducing a runny nose, and it also appeared to accelerate the recovery in the common cold patients. N-acetylcysteine may reduce the viscosity and improve the clearance of mucus. N-acetylcysteine has antioxidant properties, and these help to protect against free radical damage. It can also help to restore a healthy sinus condition that has deteriorated due to sinusitis. A 2010 study found N-acetylcysteine is capable of fighting infections, such as those that cause sinusitis, through its ability to break down biofilms. Biofilms are essentially a community of bacteria, and they adhere to the surface, including moist mucous membranes. And these biofilms are known to produce resistant communities of bacteria, and they're estimated to be involved in at least 60% of all chronic and/or recurrent infections. N-acetylcysteine has been shown to reduce the adhesion of the biofilms to the mucous membrane. Numerous studies have demonstrated vitamin E might have a positive effect on the human immune system. For instance, elderly patients who took 200 international units of vitamin E daily for 1 year were 20% less likely to catch a cold. In one study, children with chronic rhinosinusitis were found to have lower serum levels of several antioxidants, including vitamin E, than the healthy children. A 2011 study found topical vitamin E, in combination with other antioxidants, was able to reverse oxidative stress and nasal inflammation, similar to that by viral infections, chronic sinusitis, and allergic disease. And furthermore, animal studies show vitamin E might affect the risk and the severity of viral respiratory infections. Rosmarinic acid is an antioxidant compound, and it's found in rosemary. In experimental animal models, rosmarinic acid has been shown to reduce the allergic inflammatory reaction by decreasing histamine release and inhibiting the expression of interleukin-1 beta, interleukin-6, and tumor necrosis factor alpha. This mechanism of action might be significant for individuals who are suffering from chronic sinusitis that's caused by allergies. Bromelain is a proteolytic enzyme, and it's found in pineapples. It's frequently used to treat sinusitis because it reduces the inflammation and it loosens the mucus. Specifically, bromelain might inhibit the pro-inflammatory prostaglandin biosynthesis and prostaglandin E1 accumulation, and this in turn inhibits the release of leukocyte enzymes. Among the sinusitis patients, bromelain has been shown to hasten the symptom recovery and resolve the inflammation better than a standard treatment or placebo. Typical oral doses of bromelain are between 500 to 2,000 milligrams per day. Sinol is the main active ingredient in eucalyptus oil. It has anti-inflammatory and antimicrobial properties, and it also affects the ciliary beat frequency. Studies have confirmed that the sinol can thin, drain, and reduce the mucus secretions. In a clinical study involving 152 patients with acute rhinosinusitis, it was associated with a significant symptom improvement at 4 and 7 days when compared to a placebo. The authors concluded the eucalyptus was safe and effective for the treatment of acute rhinosinusitis, and they suggested it be utilized prior to the initiation of antibiotics. In 2008, a similar study was conducted among 150 patients with acute and viral rhinosinusitis, and these authors also found the treatment with the eucalyptus resulted in reduced symptoms at 4 and 7 days, and concluded the treatment was effective and clinically relevant. A combination of gentian root, primula flower, elderflower, sorrel herb, and verbena is frequently used in the treatment of acute and chronic rhinosinusitis. Results from a 2011 lab study demonstrated that this formula shows a broad spectrum of antiviral activity against viruses commonly known to cause respiratory infections. A more concentrated version of the formula, a dry extract, reduced the exudate volume and the leukocyte numbers in an animal study. It also reduced the expression of cyclooxygenase 2 protein, and it lowered prostaglandin E2 levels. Therefore, the rationality for using the combination formula to manage the sinusitis is partly based on its significant anti-inflammatory effects. Since inflammation of the mucosa can often lead to a loss of smell, researchers theorized that this combination of herbs might be useful for this indication also. Xylitol is a sugar alcohol, and it appears to enhance the body's natural defense against bacterial pathogens. An animal model showed that administration of xylitol simultaneously with a bacterial pathogen reduced the amount of the bacteria detectable upon later examination of the sinuses. In one trial, 20 subjects with chronic rhinosinusitis were randomized and instructed to rinse their sinus daily with either a xylitol or a saline solution. 15 subjects completed the study. Nasal irrigation with the xylitol solution was associated with a significant improvement on a standardized assessment of sinusitis symptoms. Another trial designed to assess the effects of xylitol nasal irrigation compared to placebo in the treatment of chronic sinusitis is recruiting participants. Nigella sativa, also known as black cumin, is a flowering plant, and it grows in Eastern Europe. The small black seed of the Nigella sativa have a rich history of medicinal use in the Middle East and Asian countries. Modern scientific inquiry has examined the potential of the black cumin seed and the oil derived from them for a variety of contexts, ranging from cardiovascular disease to cancer. Several lines of evidence suggest the black cumin seed and some of its active constituents are powerful anti-inflammatory agents, and they also combat oxidative stress. In an animal model of rhinosinusitis, an active constituent derived from the black cumin seed was found to be as effective as antibiotic therapy for reducing the manifestations of sinusitis, such as vascular congestion, inflammation, and epithelial injury in the sinus tissue. For more on herbs, supplements, and natural treatment plans, check out my website.